Hello, good evening, viewers, and welcome to your favorite show, Ask Dr. Saw. First, let me apologize to you on behalf of myself and Dr. Saw that, as you know, that there were some issues on the platform on which we would be broadcasting on. That's the Guyanese Critic platform. So from last week, when we did the show on leg swelling, I was not able to retrieve those questions because the page is not available, and I was not able to retrieve those questions so that we can answer those questions tonight. It I just want to say that I want to apologize to you sincerely for not having those questions tonight. You can still send them, and next week we're gonna deal with them. Tonight we're doing just half an hour, and so that we can be able to catch up back. But the show will be broadcasted on Dr. Saw's page and my page, so you can watch it from there. So again, sorry for the inconveniences of not having those questions to answer, but you can please send them back, and I hope that we can get them for you from next week. Good evening, Dr. Saw.
Good evening, Akash.
How are you doing, sir?
And viewers. Yeah.
All right, cool.
I was good to you.
Yeah, very well, Dr. Saw. Well, as you know, Dr. Saw, we had some issues on the platform, and we lost the questions. But again, for you viewers and patients, I encourage you to send in back your questions. Dr. Saw, tonight we are dealing with chronic coughing, and I myself has had an episode of that for when I know a cough lasts me for a few months. Thankfully, it's gone now, but it's not there anymore. So let me start off by asking you, Dr. Saw. I mean, we know what is a cough. Usually, a cough is something trying, your body reflexes trying to clear something from the throat. I believe that's the basic concept of a cough. But what is chronic cough?
Right. So we know you just said what is a cough. We all cough, so we know what is a cough. But what causes a cough in terms of the mechanism and why you cough, that's one question. And when do we say it's a chronic cough? So you have cough, or medical conditions generally are described as acute. So you have an acute condition. Mm-hmm. You have something called a subacute, and then chronic. So chronic means it's there for a longer period. But in cough, generally, we consider a cough to be chronic if it is greater than 8 weeks.
Right.
So if you've got a cough that you're coughing for more than 8 weeks, we would say that's a chronic cough. Usually a cough up to 3 weeks, we consider that as an acute cough. So, it's a short period of time. Mm-hmm. Between 3 and 8 weeks, we call that a subacute. And greater than 8 weeks, we call that a chronic cough. The question is, we all know what is a cough and why, as you rightly said earlier, why we get a cough. We get a cough because the cough is a reflex mechanism to get rid of something, of course, but it is actually caused by some sort of irritation in the airway. Mm-hmm. So it could either be a mechanical irritation or a chemical irritation. So things like fumes, of course, you can cough. You spray a perfume, sometimes you tend to cough. Smoke inhalation, or if there was something physically there, mucus, a foreign body in your throat, food in your throat, those are physical things. So it's some sort of irritant hitting the sensitive respiratory airway, and it trigger a cough reflex. And that is how, you get a cough generally. Why I chose to do a topic on chronic cough and coughing generally, it's a very common thing. All of us cough. I mean, I've been coughing for a while.
I know.
But I think my cough is probably habitual.
Yeah. Or is it?
No, we'll go through all the different causes. Yeah. But cough is so common. We see it all the time. And the most common acute condition would be upper respiratory tract infection, which give rise to a cough. So, however, when it becomes chronic, we tend to be worried. And why it is important, we see in some areas, you have about 15% of the population would have some sort of chronic cough. I don't have data on all regions of the world, but we have some data on isolated areas. You can have a high percentage. We know it accounts for about 10% of specialist referral. So you go to your doctor and you have a cough, it's not going away, you start worrying. And of course, the first thing that comes to mind, and we see all these ads on television that, okay, if you have a chronic cough, see your doctor. And at the back of our mind, we're worried about diseases, serious, sinister pathology. We're worried about cancer. So we can say the impact of chronic cough is huge. We have physical impact, so it impacts our body. When you cough, you get pain. So you can get chest pain when you cough. You can get hoarse throat when you cough. It can affect your sleep. So physically, it affects you. Psychologically, it can affect you. You're worried about, oh, right, could this be cancer? Could this be TB? Do I have something else going on? Am I going to die? Is this the beginning of something more serious? So psychologically, it has a great impact. Socially, I mean, it's a massive impact socially. You know,
that's right.
During the COVID time.
Yeah, you dare not cough among people.
Absolutely. You would see, I would go in the train, for instance, and you see somebody coughing and everybody would walk away.
Right.
And give that person space.
Yeah.
So think about it, you're coughing at your job. Your co-worker is going to say, right, you're ill, they don't want to be around you. They may think you have a contagious condition. So it has physical, psychological, social impact. So it's not just a trivial topic. And as we go on, I'll explain all the details of, but the impact is huge.
Doc, I just want to ask this question. Look, when people have a cold, I know that usually it's accompanied by a cough, and then you'll have that cough, then you'll bring up mucus, you say you're coughing up cold and so on, and then that cough morphs into a dry cough. And that dry cough is irritant, nighttime you're sleeping and you can't sleep properly, it's, your whole body. What causes that? What causes that?
Well, I explain that to patients in a way where I say, okay, you have so that is an acute cough going on a little bit longer than just that 3 weeks, and it go on for a little bit longer. But it is not to say that there was something more serious. So you've described a situation there where you have, first you start with an upper respiratory tract infection, and the most common cause for that would be a viral infection. So there are lots of viruses. Your common cold, influenza, common cold, whatever upper respiratory tract infection you've got, it can manifest with a cough and cold. So you have mucus. I said just now that you have some irritants to the airway. So when the virus gets into your airway, you have some glands. So our airway, from our nose going down to our sinuses, our throat, you have what we call the trachea, and then it branches into the bronchus, and it leads into the lung. And after the bronchus, you have something called bronchiole. So these are smaller airways, right? Now, in the bronchus, you have cells that produce mucus. So when there's an infection into those cells, you have an increase in mucus production. And also, the body has a way, you have some cells that line the airway where it pushes matter, like physical irritant, it pushes it out so that we can bring it up.
Right.
And we expectorate or, spit it out, whatever it is. So there are some cells, we call it cilia cells, that move, it brushes it cleans the airway.
Right.
So when you have an infection, all those bits are inhibited, you have more mucus production, and it have a dysregulation of that system. Now, an acute cough, as you say, it goes away. You heal from that acute cough, meaning that the fever and the acute episode resolve, and you're left with a little dry chronic cough.
Yes.
Now, I explain that as a little, what we call a post-inflammatory cough or post-viral cough, generally. And this is a very common condition. As a matter of fact, I will say majority of patients that I've seen coming to me for cough symptoms would be because of this condition called post-inflammatory or post-viral cough. And that is classic. The history is clear. They've come with a viral infection, cough, cold, runny nose for 2-3 weeks, and then they left with a cough for another couple of weeks. So that's a post-inflammatory cough. And how I explain it is that the airway is not fully healed. So the airway is still inflamed, and you're setting off a vicious cycle. So every time you cough, you're creating irritation to the airway, and you're having that vicious cycle. So it takes longer to heal. And sometimes what I do, I would say, okay, we need to break that cycle. I would give some steroid, and that is via inhalation as an anti-inflammatory, and I would give a cough suppressant, and just to break that cycle. And most times that will go away. You know, it may last for 6 weeks, 4, 6 weeks, 8 weeks, whatever. So a majority of those coughs will go away, but the classic history is that it starts with viral infection, and you know you have cough, cold, runny nose, and they go on. So you can be reassured here that, oh, well, this is nothing more